Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss how the privatised test and trace system that the government continues to stand by has become so dangerously reckless that it is using untrained staff now to fulfil roles that can only be effectively carried out by trained and experienced clinicians. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, take a look at this. I saw someone link this on social media. I've had a few people draw my attention to it this morning as well. It's an advertisement for a role within the Department of Health and Social Care to work on the failing tracing system. The deadline is today, so a bit too late to apply, as it happens. So I'm guessing it's been out for a few days at least. I only had my attention drawn to it yesterday. It's asking for someone to head up a team dealing with COVID contact tracing. You could get up to £2,000 a day for it. There are some interesting specific requirements. In fact, the one majorly interesting specific requirement: experience and evidence of turning around failing call centres. A phrase that hides a multitude of sins. They need people who can turn around failing call centres, thereby frankly admitting that their tracing is failing, because that's where they'd be working. The call centre is for calling people who are either isolating or to call them to tell them to isolate. They also need you to supply evidence. Now, this isn't one of those situations where they will listen to you in an interview and listen to you giving examples of how you've done this in the past and how you would do it in their particular case, and risk hiring someone who's just good at blagging their way through an interview. No. This suggests that the situation is so dire that for once they want genuinely experienced and competent people, and they need you to be able to prove that you have this competence. They've spent, just to provide some context here, £56 million at least on consultants, some of whom we know were paid up to £7,000 a day, to advise them on setting up and running a world-beating test and trace system effectively. £56 million was spent on consultants. Here we are now. We are needing to hire team leaders who have proven experience of turning around failing operations. The operation has failed. They've spent £56 million on experts, and it's not even not working as well as they would like. It's actually failing. They need now to hire people who can deal with that failure. This is a disgrace. It should, of course, be a national scandal. But when you look at the whole thing, this actually, to be fair to the newspapers, is on the tamer end of this fiasco. A report in The Independent was describing how, on the testing side of things, the system is so far from being able to even pretend to cope that they have drafted in completely untrained workers to carry out clinical assessments. Now, this is not like the tracing thing where they got a load of people in a call centre, they gave them a 2-page PDF as their training, and you just call people to tell them to isolate. Okay, that part of the job, you could argue you don't need a huge amount of training. Most of the training will be on how to use the cumbersome system they have. Now, this is clinical assessment. These untrained workers are being employed by Serco, of course, they have most of the contracts for this, and Cytel, according to the leaked emails that they saw. Actually, clinically trained staff who've been working on this have had to point out that this is putting patient safety at risk. They explained that trained and experienced nurses, for example, can spot the signs of ill health, when you're having a conversation with someone, when you're assessing their needs, and you can therefore effectively triage. What's an untrained worker going to do? They'll be reading off a flowchart, won't they? The patient could do that themselves. You could just direct them to that themselves. A clinician will be able to identify signs that could lead to them calling an ambulance for someone. The one example they gave was their breathing is a little bit of a shortness of breath, in a way that only a trained clinician would really recognise as an issue for which you actually need to go to hospital. But other things as well, just little signs that show the need for urgent medical care that a trained and experienced clinician can pick up on, and a completely untrained inexperienced, low-paid worker with a flowchart cannot. You know, a low-paid worker from Serco with their 2-page PDF, no chance. You know, they'll be no better than an automated system. And in trying to defend this, the Department for Health said that any case that requires medical support will continue to be escalated to medical professionals. But this misses the point entirely. What you've got is unqualified assessors. They will not know whether someone requires medical support unless the untrained patient at the other end of the line recognises it themselves. They won't pick up on any signs because they aren't medically trained or experienced. Signs will be missed, health will suffer, people will die. And, you know, do you know something else as well? So last week was a key date for the Serco contract. There was a clause in this contract that allowed the government to just cancel it and go their separate ways if they were unhappy. The date to trigger that clause has now passed. This presumably means that if the government tried to axe Serco now, that would come with severe financial penalties. We're stuck with them. Sure, it's right that people keep calling on the government to stop this madness and give the funding and other resources to competent groups, you know, healthcare professionals, preferably the NHS, because this isn't even about privatising our healthcare. Like, if they'd at least given the contracts to private healthcare providers, it would have worked a lot better. You know, it would have been more expensive. They may have still cut corners in the name of profit, so it may have been less than ideal, but it wouldn't have been this mess. We wouldn't have had the incompetency aspect to it, would we? You know, to give such sums of money to providers who have no idea what they're doing, who need to spend £56 million on consultants to tell them what to do, and then they still end up with a system that requires them to employ team leaders with a proven track record of turning around failing operations. And the government had the option of saying, do you know what? We've stuck by you for months. You've loused it up every single time. Piss off. We're in too deep here. Piss off. It's too important. And we'll give the money to someone with a level of expertise here. And they didn't do that. And this isn't about ideology, but pure corruption. You know, it's about slinging vast sums of money to groups who've contributed to the coffers of the Conservative Party and individual ministers like Matt Hancock. And it's not just a lack of clinical training in staff expected to make clinical judgments. So back to tracers now. And again, it's also expected to exercise legal judgments without any training as well. So there was another report, and that explained that with the new rules, and the police are supposed to be involved now in making sure people are self-isolating, contact tracers are supposed to compile lists of names of people that they think are at risk of not complying. You know, they suspect of flouting the rules, to be passed on to the police so the police can chase that up. But the tracing staff expected to do this have not been given any training. There are no criteria to use for many of them. Just use your judgment, they were told. It seems that how much guidance they were given depends on their own team leaders, because none has come centrally. So some staff have had none at all. Some have had a few little bits of guidance, again, depending on whether their manager's any good or not. But no central advice. So staff who are not necessarily trained in any more, you know, anything more than using a phone. They're not trained in analytical thinking, for example. They are expected to try and work out, when they're on the phone to someone, if that person is isolating or not, without any guidance. You know, this is not as serious as clinically assessing someone without clinical training or experience, of course. You know, because that could cause real harm. The worst this one does is get the police round to someone's house, find out that they're in, and then do nothing because there's nothing to do. It just wastes police time, which is bad enough. But it's just another example of the failure to apply even basic standards to the operation. How are we paying these companies so much money when they cannot even get the basics right? I alluded earlier to the notion of the untrained clinical assessors referring to a flowchart. That's just an assumption of mine. That was just the thought that popped into my head. Perhaps they don't. Perhaps they're just told to use their judgment with absolutely no guidance or PDFs to include in their toolkit at all. And amongst all the corruption and effective theft of public money, It needs to be remembered that the service these companies are supposed to be providing are actually really important. You know, I have spent decades complaining about numerous governments wasting public money on expensive privatised versions of what the state could have provided at least as effectively and more cost effectively. But that is, you know, political. That's a political debate you can have, and indeed I have had. This is next level. They are providing sums of money well over the odds, well beyond market value, for a vital service that we are not even getting. And because we're not getting it, the pandemic is running out of control. And because the pandemic is running out of control, genuine businesses are suffering badly. Viable businesses are failing. People are facing financial hardship, social hardship, health problems of all kinds, and they're not being addressed as they should be. And all because of this, all because the government did not do what they knew would be the right thing to do for the country. But anyway, I'll leave that there. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.